Experiment on the correction of post-injection cutaneous hemosiderosis using an erbium laser. Good evening, dear colleagues. The experiment on the correction of post-injection cutaneous hemosiderosis using an erbium laser is presented to your attention. Drug-induced hyperpigmentation is known to cover from 10% to 20% of all skin hyperpigmentation cases. As a rule, it is represented by skin hyperpigmentation, hypopigmentation, as well as dyspigmentation. The mechanisms of occurrence include increasing the number of melanations, their active forms, and increasing the melanin production, as well as depositing the drug itself, its metabolites, and post-inflammatory hyperpigmentation of the skin. Dyschromia induced by the metal metabolites can be one of the dyschromia types. They are presented in the form of achronosis, argyrosis, and siderosis. More attention will be given to a skin siderosis. Siderosis is a secondary argyrosis, skin pigment dyschromia, which occurs as a result of an iron intravascular or intramuscular administration. The histological pattern is represented by the iron-containing macrophages located perivascularly and periadnexally, both in a skin and a subcutaneous fat. The peak absorption of iron is the visible spectrum of the laser radiation. Therefore, an alexandrite laser and a KTP laser with the wavelength of 532 nanometers are typically used for this dyschromia treating. A patient with dyschromia that is located in upper femur contacted our clinic. The dyschromia appeared as a result of an iron administration 2 years ago. She has been conducting the therapy on the dyschromia during these 2 years. She underwent mesotherapy, PRP therapy, and hiridotherapy, which led to the scar formation. Since the visible spectrum of the wavelength range is used, an alexandrite laser and a KTP laser based on the multi-line laser system were used in my practice. And as it was the skin pigmental degeneration, I decided to use an erbium laser with an SMA module on the multi-line laser complex, having a remodeling effect as well. What was the result of this? These are the pictures before and after the procedures. In 4 weeks after the procedure, the patient and I evaluated the results of exposure, which indicated that using an erbium laser with the SMA module showed the best outcome. Afterwards, the therapy was conducted using the erbium laser with the SMA module based on the RecoSMA method. Only this technique was applied, which led to an almost complete removal. During 5 procedures over 4 weeks, we used this method of exposure. As a result, we concluded that the use of an erbium laser with the SMA model is an effective and a safe method of an exposure for correcting the skin pathology given, and it can be recommended for widespread using.